Wellness for Life is brought to you by Back in Motion Physical Therapy, Gottenborg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi, my name is Ernest Tota. I'm the owner and director of Natural Alternatives in Monaga, Minnesota. We have multiple clinics throughout the entire state and also in Moorhead, near Fargo-Moorhead area. And one of the best things about Natural Alternatives is the collaboration, the synergy of multiple practitioners that work together. Dr. Mark Wheaton, Dr. David Gottenborg, and Dr. David Anders all team up with me here. Plus we have 6 therapists that work under us. And our goal is, through this collaboration and synergy of practitioners, to come up with ways to help people that are struggling with issues that they haven't been able to find help elsewhere or have maybe had an incomplete recovery of an issue. And so our goal is to be able to collaborate together to make that happen. Today, one of the things that I'm going to cover is something that's very, very unusual and not very commonly addressed in the healthcare world, and that is the issue of injury, soft tissue injury, or complications involving the rectus abdominis. Now, this is a muscle, and I'm going to show this because I was able to go on the internet and just print these off. It's very, very easy to do. But if you can visualize a muscle that inserts here at the pubis bone and goes up to the bottom of your rib cage. On her right now, I have a set of leads right here that are hooked up to just above the pubis bone in here. So I'm treating this rectus abdominis. This muscle is a very, very powerful muscle, very commonly seen in weightlifters who really spend some time developing it, and they walk away with what is called the six-pack abs, very well-defined muscle structure in the abdominal cavity. The key to understanding this muscle is that how does it relate or interact with the low back? And these pictures here give us a little bit of a understanding of that. So here is a picture of the lateral view of the external oblique, and then the rectus abdominis, of course, is flowing up the front side of the body. But this is called the transverse abdominis. So these muscles overlay and come in underneath the rectus abdominis and go to the back, and you can see the sheath of this muscle structure tied into your lumbar, or to anyone's lumbar. And here again you see the internal oblique structure, how it fans across the top of the ilium, which is your hip joint, and goes up into the side of the abdominal wall and rib cage and ties even into the ribs. This picture in color is also another good shot. These are all available on the internet. I found this under a website called Visible Body. A lot of good stuff to be able to see. Here's a little better picture of how the rectus abdominis is defined. Blood flow and all kinds of circulation and lymphatic flow, especially on women in the pelvic area in here, is compromised by weakened or torn abdominal muscle structure. So there's all kinds of reasons why people struggle with abdominal pain. Sometimes people come in and say, well, I'm suffering with stomach pain, thinking that it's maybe a digestive issue, when in fact it's not. It's actually an injury of the soft tissue structure involving the abdominal wall. And so people who suffer with chronic low back trouble could be going to a chiropractor or other practitioners trying to get help for low back pain, are not realizing that this weakened or injured abdominal wall, and especially the rectus abdominis, is part of the reason why they're suffering. And our goal is not just only to say, okay, we'll treat it with microcurrent therapy and massage and muscle work and so on, but also to sometimes recommend specific exercises or direct them to get in touch with their physical therapist. And somebody who could, maybe a rehab specialist, who can help guide them through that next phase, especially if it's a work recovery injury or something of that nature. So our goal is to help facilitate that, and especially mothers who have had babies, multiple pregnancies, labors, and deliveries. Those people will really, really suffer with this kind of pain, and sometimes they'll actually get a separation right along this line where you can see the abdominal wall. The rectus abdominis is also flipped on the opposing side. They'll get a tear involving this like ligament minutiae or fascial structure in between these two muscles, and it'll tear, and it weakens the abdominal wall to the point where they have chronic low back trouble. And again, pregnancy and labor and delivery is associated with that. Another interesting component is people who struggle with having had coughing, severe sneezing, or even eructation or vomiting can cause injury to this muscle structure. So again, at Natural Alternatives, our goal is to try to help come up with alternative ways to address these types of issues, and again, collaborate together to help resolve issues that involve the stomach wall and its muscle structure. Very, very complex, but yet incredibly important to the low back. Check us out on the web, naturalalternatives.com, and that's natural with the E at the end of it. 218-564-4200 is our main office number, and you can also go to the web and find our other locations. Thank you.
thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gottenborg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.